Alright, now we're going to begin the surgery. We're about 2/3 the way down the snake. We have placed another absorbent towel underneath because the snake is shedding. We are trying to not get too much dirt in the way. We'll pinch the snake, looking for any kind of reaction. If we had a reaction, we would not proceed. If we're starting the surgery and we start to see any kind of response by the snake, we'll stop and wait for the snake to be further anesthetized if need be. Typically, I will not use a scalpel, but a sharp pair of scissors will work just as well. The scalpel works too, though. But we're just trying to go just through the skin. A nice straight line. I am one scale row up from the ventral scales. Sometimes you can do this without hitting any kind of capillaries. Sometimes you hit a little capillary like that. And there's just a little bit of blood. There's a little bit of blood. We get a sterile absorbent pad. There you go. Now take our probe. We'll reflect the skin down. You can see here we have the ribs, and the muscle in between the ribs is the costal muscles. And we can take these, we can reflect them up. And underneath is a clear membrane. Sometimes there's a little bit of muscle there from the abdominal muscle that you can just get through. It's a very thin piece of muscle. Barely even need the scalpel for that. You probably could just do that with forceps. But now we're just looking at the peritoneal cavity. You can see fat muscles. If we were further up, you'd see organs, but because we're further down, the only thing that should be in this area here are going to be the intestines. I have sharp, small scissors that I use just to make a very, very small nick. And I'll use my forceps to just make that a little bit bigger. We now have our antenna. Just trying to dry it off as best as I can. Here's our transmitter. It's an SI2 from Hula Hill. On the back end, potted in the black color, is an I button from Embedded Data Systems. That goes in that hole, right into the body cavity. Slide it down in, and then let the ribs go back over top. Now take our sutures. Some say this is not needed. I will put a suture through the costal muscle and around the antenna. To me, this is just giving me a little bit of security that the transmitter is not going to migrate. We then have our needle with the lower lock removed. We're going to run this subcutaneously along the side towards the head. Make a very small incision anteriorly. Run that all the way underneath the skin, and then we can thread our antenna through. Just make sure that's sitting nicely, just like that. Then take our sutures. I'm going to put another suture anchoring the antenna to the intercostal muscles. At this point right here, I typically have had in the past, I've had the antenna bulge a little bit. It doesn't sit exactly flush. The Holo-Hill transmitters, the antennas are a lot looser, so they're a bit better, but other companies, I've had them be a little bit more stiff. This is just making sure it's not going to bulge as much and press up against the skin. In the past, when I've had it bulge like that, sometimes it will rub through the skin over time, and then you have to bring the snake back to the lab and put the transmitter antenna back in. Once that's situated, I then pull all the way through, and that's good. If you want to put a suture towards the front there, that's fine. I don't feel it's necessary every time. Now we'll start suturing our snake. This snake is shedding, so I'm going to remove a little bit of that shed skin just so it doesn't get in the way. Before I forget, I'm going to put a little bit of analgesic on here. This is lidocaine. 2 drops. That way when the snake wakes up from the anesthesia, it's hopefully comfortable. This time, we're going to remove the snake from the tube and removing it from the anesthesia, if any is still within the tube. This allows the snake to start recovering. The snake never fully recovers in a very quick manner. It's a very slow recovery. So removing it, allowing it to recover now, means a quicker recovery time. For the snake, so that when we're finished we can quickly take some data from the snake and we don't have to worry about the snake overdosing or us sitting here for the rest of the day waiting for it to recover. At this time, even though the snake is still anesthetized, we'll keep a distance and keep an eye on the head of the snake. Still treat the snake with the respect it needs to be as a venomous snake. You can put down recovery time and surgery over. Clean the snake up. We'll keep the snake in the lab for a few days. It'll probably finish shedding in the lab. And that'll be good because then if any sutures need to be redone or if some the old skin's getting caught on the sutures, we can fix that. And that's surgery on the snake. So Ray and I will take data on it real quick. Do not need the gloves anymore. Take a snout vent length. We've already counted subcaudal scales and the rattle number. The snout vent length of our snake is 1145. 1145 snout vent. Tail length on our snake is 113. And rattle length is 55. We had 26 subcaudals on this snake. It's definitely a male. We don't have to probe it. As a female, we'll never have that many. We're going to give it a pit tag. We're going to take a scale clip, it's a tissue sample, and we're going to swab for snake fungal disease. And then we're going to try to take some venom as well for a separate study that's being done. Everything that goes into the snake we try to sterilize as best as we can, or at the very least get as clean as possible. Our transmitter included, or not transmitter, our eye button, not eye button, figure it out, pit tag. Good thing I can edit these videos. So we'll put our pit tag in the snake as well. Dip in the alcohol. Let it dry off a little bit so we're not shooting alcohol underneath the snake's skin.